Hello, my name is Marcia Williams, and I'm a nurse practitioner and a PhD student at the University of Utah.
And my name is Kristianna Durham. I'm a health educator in charge of our tobacco program at Greene County Public Health.
And we're so excited to be able to present our collaborative, we're excited to be able to present to you our collaborative partnership with the primary care and local health department at Greene County, Ohio. And we wanted to highlight some things kind of quickly for our presentation here, but that we wanted to highlight the disparities of tobacco-related illnesses in rural communities. And we also wanted to present kind of an old concept from the 1970s of combining the primary care with local health departments and the community. This actually has been emphasized in greater detail since our recent global pandemic. In our particular case, we had a local health department, kind of a floundering grant, and a rural health clinic with a high percentage of smokers. 18% of our county smoke. And this disproportionately affects those with low socioeconomic status. And we know that something that's also new, we get the highest value of prevention for smoking cessation and immunization. And so we wanted to really work on this together.
And so the purpose of this program's intervention is to raise awareness among county residents and monitor policy adherence among institutions that sell tobacco. The primary outcomes of this program are to promote resources, educate on the dangers of tobacco use, and prevent further utilization of tobacco products through policy change and responsiveness. We formed a tobacco task force with different community members, and we wanted to make sure we had a representative from each sector, including health, education, law enforcement, government officials, businesses, community members, and organizations. And so this has been really helpful to just kind of get a community's perspective on what we can do better in the community and what we have been improving on. We also did an annual tobacco stakeholder survey with various members in the community to just kind of see where we're at in response to change for our tobacco efforts. And so we had a pretty low score. We had a little over 4 out of 10, which means that we just have a lot of room to grow. We talked a lot about just the knowledge of our tobacco efforts, leadership, the community climate, survey issues regarding tobacco, and resources we have available.
And so we think that this serendipitous match between the local health department and public health is definitely a transferable concept to your community as well. Along with that, seeing the needs from our survey, is we wanted to use a socio-ecological model to make sure that we were meeting the needs in a most researched manner and using best practice here. So some of those individual and interpersonal levels that are probably similar to your communities too are those age, the occupation, educational level, and also the economics. And we know that all these things factor into people's starting smoking and also the willingness to quit. The interpersonal level, we know that parents and social environment makes a huge difference, especially to our teens and their access to products. The organizational level, the anti-smoking policies at work sites, tobacco-free initiatives at schools, all of these work together at the community. We wanted to make sure that we network between the organizations and institutions that make up the greater community, like our Parks and Rec, for example, because this is definitely where health behaviors originate. So they're very important to our community strategy. At the organizational level, we want to make sure that we're enforcing behaviors, determining regulations and restrictions, also policies, laws, and taxes. And along with that, Kristianna and her department has had an opportunity to do spot checks with teens to see what their availability is in selling to underage at convenience stores. And we also wanted to just kind of highlight just a little bit of how some of our limitations and strengths, and we're kind of doing that from both of our lenses. And the primary care, I'll just kind of quickly go through. I've been able to be influential with different providers, talking to them about how to code, because money always talks, and it also represents to our payers that we've been able to make some of these recommendations to our participants. Speaking of participants, we're just trying to change the terminology a little bit, or understand collectively what that looks like from a population standpoint from primary care. That sometimes is our panel, from a population from the health department, that is often geography. So just kind of incorporating those, and then also looking to model collaboration in all of our voices and efforts so that the community is seeing a strong united front of why this is important.
And so some things we've been doing on the health department side, we are grant funded. And so our grant is from Ohio Department of Health. And so we are limited in that. And so we've been doing a lot of policy and enforcement with schools and tobacco retailers to make sure they're not selling to kids under 21. We've been doing some community engagement, such as working at summer camps and doing tobacco education there, doing like an anti-vaping sticker contest, or setting up a booth at our vaccine clinics and just educating people on our tobacco resources there. We've been working with schools to make sure they're all at 100% tobacco free with their policies. We've been working with elected officials to just help work on some policies, doing some college surveillance. And we also have one of the only African-American land grant universities in the state of Ohio, Central State University. So we've been working with them especially to really work with our disparate populations, and just doing a lot of community surveys, which are from ODH. So we're a little bit limited because they're for the whole state of Ohio. But they've been really good to get some good data on that.
So despite that external validity being problematic, making urban and rural just to be able to answer the same survey data, we really think that these are concepts that are transferable to your community, and we really appreciate your time today. Thank you so much. Goodbye.